Hi everyone, I'm Pharmacist Michael, and welcome to my channel. Today we're diving into a topic that might surprise you. Medications you're taking that you might not actually need. Yes, you heard that right. Over time, some medications may become unnecessary, or there might be safer, more effective alternatives available. Stick around as we talk about some common medications you should reconsider and how to have a conversation with your healthcare provider about simplifying your regimen. Many people are on medications they no longer need or that they were prescribed years ago and never reevaluated. Life changes, your body changes, and your health needs evolved. But medications are often left on autopilot. Here are some reasons why you might still be taking unnecessary meds. Your condition has improved or resolved. The medication was meant for short-term use but became long-term. There are new guidelines or better treatments available. You're experiencing side effects that outweigh the benefits. It's important to regularly review your medications with your doctor or pharmacist to ensure they're still appropriate. Let's talk about some of the most common medications that people take unnecessarily. These are medications that, in certain cases, could be reduced, replaced, or stopped altogether, but only under the guidance of your healthcare provider. Many of these medications were prescribed for short-term use but have become long-term without proper reevaluation. Let's take a closer look at some of the most common classes of medications you might not need. Number 1 is proton pump inhibitors or PPIs. Medications like omeprazole or Prilosec and esomeprazole or Nexium are often prescribed for acid reflux. While they're effective, long-term use can lead to nutrient deficiencies, kidney problems, and an increased risk of infections like C. diff. Many people can manage reflux with lifestyle changes such as weight loss, reducing alcohol intake, and avoiding trigger foods. If you've been on a PPI for more than a few months, it's worth discussing a step-down approach with your doctor. Antihistamines. Long-term use of antihistamines like diphenhydramine or Benadryl can cause drowsiness, dry mouth, and even cognitive issues in older adults. While they're great for short-term allergy relief, they're not intended for daily long-term use. Newer antihistamines like loratadine or Claritin and cetirizine or Zyrtec are less sedating alternatives, but even these should be used judiciously. Statins are commonly prescribed to lower cholesterol and reduce the risk of heart disease. However, for some older adults or those with low cardiovascular risk, the benefits might not outweigh the risks, especially if they're experiencing muscle pain or other side effects. Recent guidelines emphasize that statins should be used based on a person's overall risk, rather than just their cholesterol numbers. Talk to your doctor about whether you still need to be on a statin, especially if you have no history of cardiovascular disease. Antibiotics are life-saving when used appropriately, but their overuse can lead to antibiotic resistance, making infections harder to treat. Some people are prescribed antibiotics repeatedly for chronic conditions like sinus infections or urinary tract infections without exploring other treatment options. It's important to only use antibiotics when absolutely necessary and to always complete the full course as prescribed. My favorites you should get rid of if you can: benzodiazepines. Medications like lorazepam or Ativan, alprazolam or Xanax, and diazepam or Valium are often prescribed for anxiety, panic disorders, or insomnia. While they can be effective in the short term, long-term use can lead to dependency, tolerance, and cognitive impairment. There are safer alternatives available, including SSRIs, cognitive behavioral therapy, and non-habit-forming sleep aids. If you're taking benzodiazepines regularly, discuss a tapering plan with your doctor. How about over-the-counter pain relievers like ibuprofen or Advil, naproxen or Aleve, and acetaminophen or Tylenol? These are widely used for chronic pain. However, long-term use can lead to liver or kidney damage and an increased risk of gastrointestinal issues. If you find yourself taking these medications daily, it's time to look at other pain management strategies such as physical therapy, exercise, or mindfulness practices. While antidepressants can be life-changing for people with depression, anxiety, and other mood disorders, some people remain on these medications long after their symptoms have resolved. If you've been on an antidepressant for several years, it's worth having a conversation with your healthcare provider about whether you still need it. Keep in mind that stopping antidepressants suddenly can cause withdrawal symptoms, so any changes should be done gradually. What about diabetes medications? Certain medications used to control blood sugar levels, like sulfonylureas, glipizide, and glyburide, may not be the best option for long-term use. These medications can cause hypoglycemia, especially in older adults. Newer classes of diabetes medications, such as GLP-1 receptor agonists and SGLT2 inhibitors, may be safer and more effective alternatives. Regularly review your diabetes medications with your doctor to ensure they're still appropriate. What about multivitamins and supplements? Many people take multivitamins and supplements daily without knowing if they're actually benefiting them. In many cases, a well-balanced diet provides all the necessary nutrients. Taking unnecessary supplements can sometimes cause more harm than good, especially if they interact with your prescription medications. Sleeping pills, medications like Zolpidem or Ambien, and Ensoplicone or Lunesta are often prescribed for insomnia. But these medications can be habit-forming and may not improve sleep quality in the long term. Behavioral interventions like sleep hygiene practices and cognitive behavioral therapy for insomnia are often more effective and safer in the long run. Beta blockers for blood pressure, like metoprolol and atenolol, are commonly prescribed to lower blood pressure. However, for people without heart conditions, they may not be first-line treatment anymore. Newer guidelines recommend other medications like ACE inhibitors or calcium channel blockers as first-line options for hypertension. If you're taking a beta blocker solely for blood pressure, it's worth reviewing with your doctor. Hormone replacement therapy, or HRT, is often prescribed to manage menopausal symptoms, but long-term use can increase the risk of certain health conditions, including breast cancer and cardiovascular disease. For some women, the risks may outweigh the benefits, especially if they've been on HRT for many years. Talk to your doctor about whether you still need hormone therapy or if safer alternatives exist. If you think you might be taking a medication you no longer need, don't stop it suddenly. Many medications need to be tapered off to avoid withdrawal symptoms or adverse effects. Here's how to approach this process safely. Review your medications with your doctor or pharmacist. Ask your healthcare provider for a medication review. They can help you identify which medications are still necessary and which ones could be reduced or stopped. And again, don't stop medications abruptly. Some medications like antidepressants or blood pressure meds need to be tapered slowly. Abruptly stopping them can cause serious health issues. Consider lifestyle changes. In many cases, lifestyle changes can help reduce the need for medications. For example, improving your diet, exercising, and managing stress can help with blood pressure, cholesterol, and anxiety. There are certain situations where you should be extra cautious about stopping your medications. For example, if you have a chronic condition like diabetes or heart disease, if you're taking medications for mental health, or if your doctor prescribed a medication for a specific ongoing condition. Always talk to your healthcare provider before making any changes. Continuing to take unnecessary medication is not only expensive, but it can also be dangerous. The more medications you put into your body, the greater the risk of side effects and drug interactions. One of the biggest problems I have seen in my career as a pharmacist is patients continuing to take medications without ever questioning whether they're still needed. So let's recap. We talked about why you might be taking unnecessary medications, some common meds to reconsider, and how to safely reduce or stop them. Remember, medication reviews are a crucial part of your healthcare. It's your health, and you have the right to ask questions and make informed decisions. If you found this video helpful, give it a thumbs up and share it with someone who might benefit from it. Don't forget to subscribe for more tips on living a happier, healthier life. I'm Pharmacist Michael, and I'll see you in the next video. Take care and stay healthy.